Right, to go back to the other thing,
That's
if you want to hear from the people though, you can ask them to come talk on it though.
Unless the board has anything they'd like to say to start the conversation, I would like to hear from them. Hello again.
Hello again. I'm back. So this time I'm coming before you as TASP. TASP.
State your name.
Oh, yeah, sorry. I'm Ashley Arnold. I'm
We
an
know that.
LSSP, NCSP, and I am representing the Texas Association of School Psychologists on this matter.
Thank you.
So TASP comes before TSBP yet again to advocate for our title change. We have literally lost count how many times we have stood in this very building stating why this change is needed, as well in the hobby building. You have in your agenda packet our letter and supporting documentation from the National Association of School Psychologists supporting the necessary use of the title of school psychologist. Therefore, in the interest of time, I won't repeat information that you already have in front of you. This is my 20th year as an LSSP, and each year feels like the movie Groundhog Day and working with families, school staff, and community members trying to explain what an LSSP is and does. Every year, I have principals say to me, "My LSSP can do that?" Every year, I have sat in meetings with central administration staff lamenting the supposed lack of school-based mental health professionals in their district or on their campus, and the conversations fail to mention the very LSSPs that are employed in their own district. I have presented to special education directors across the state about the comprehensive role that LSSPs can provide, and their response is always, "My LSSP can do that?" Each time this happens is like a slap in the face to the almost 4,000 LSSPs in the state that provide necessary mental health services to the children and youth of our state. The final point I will bring up is just last night I was forwarded a news article from CBS News with the headline, "Half of all Texas school districts have no mental health services. Uvalde was one of them." When you read the article after this sensational and misleading headline, the article states that using data from the Texas Education Agency, that the Uvalde Consolidated Independent School District had no school psychologist on staff. This is wrong. There are 2 LSSPs employed in that district, but of course, we're not classified to TEA as school psychologists, but as LSSPs. So CBS News didn't know to ask how many LSSPs are employed in that district. Given the tragic event of the murder of 19 children and staff, this false news article is the punch in the gut to those LSSPs that were providing services in the days after that and holding the hands of those grieving family members following this tragic school shooting. How would you feel knowing that you did the best that you could in the days following one of the worst professional days of your career, only to see, as you were trying to prepare for a new school year, that you didn't exist, that the services you provided didn't happen? They are school psychologists. We are school psychologists. Say our name. Thank you.
Thank you. Thank you for being here, and thank you for your words there. I want to come back to something you said in the beginning a couple of times, things about saying my LSSP can do that. What are, for the edification, I have some ideas of that, but I can always be better educated, and I'm sure for anybody out there in the public, like, what are those things?
So an LSSP can provide free evaluations in the public school setting, meeting TEA eligibility criteria of dyslexia, autism, specific learning disability, emotional disturbance, and other health impairment. There's roughly 9 others. We can also do counseling. We can provide behavior management techniques. We can provide consultation with families and with staff and with community members. We provide crisis intervention services. We provide professional development. We talk about learning strategies of our youth. There's a wide, comprehensive role that school psychologists provide.
So it sounds like in most of those cases, like, you can provide counseling, but you're not going to be the primary therapist.
So we provide counseling as a related service because frequently your school counselors are often tasked with doing, unfortunately, class schedules, doing the STAR testing, providing 504 accommodation and paperwork. So frequently a lot of our school counselors don't get to do counseling. And in fact, during the last legislative session, they had a bill that mandated a certain amount of their time couldn't be for paperwork. But when we really look at children that receive special education services that need counseling in order to access their education, that's when LSSPs come in and provide that service.
Well, it sounds like you're more of a stopgap. Is probably not a good way of putting it. But
Right,
you're
no.
not. You're not.
We're an additional mental health professional in the school
Right.
that's not being accessed. And as we know, with 1 in 5 children and youth having a mental health disorder, most children and youth access mental health services in the school setting.
Ms. Arnold?
Yes.
Thank you so much for bringing that here. I think you made a very, very clear and passionate argument, and I appreciate that.
Thank you.
Being a little bit uneducated about this, can you help me understand, because I probably think that you're clearly understanding of this, what is the dissenting argument about this?
So the dissenting argument in the past has been the protection of the title of the word psychologist, that it would be confusing to the public versus psychologist versus school psychologist. And we would just like to point out that Texas and Arkansas are the only 2 states in the nation that with the same level of training, same credential, we cannot call ourselves school psychologist.
Got it?
So it's very defeating to people that move in from out of state. Like I'm in Kansas, I'm a school psychologist, and I cross, or I'm in Oklahoma, and I cross the Red River. Now I'm no longer a school psychologist.
Your 4 letters.
Correct. Your 4 letters that nobody can remember the exact order or what they mean.
Right. Any other questions?
Ms. Arnold, I'm also very moved with your presentation.
Make sure, Dr. Singh, make sure your mic is on.
So everyone can hear you. Can you
Oh,
get closer to your mic?
well, these chairs are like for cowboys. Okay,
Is your light on?
it is.
Okay, good.
I have. If you were just dreaming, whatever you can get, and you would be given, what is your wish? What would you like? Let's say if you were dreaming, what would you like this board to do for you?
I would like for you to propose a rule today changing the title of the license LSSP to school psychologist to match 48 other states in this nation.
What do we do with the ones that have already titled as school psychologists?
Well, so you can, the issue, the name of the license is LSSP. PhD level school psychologists can call themselves school psychologists. Those of us at the specialist level, we cannot. We have to say, I'm an LSSP. And they say, what? I'm a school psychologist, but I can't really say that. Oh, okay, well now I know what you're doing. Now I know what you do. So it's changing the name of the license.
So, but we can't have 2 levels of school psychology.
You won't have 2 levels.
Yes.
You won't, because you still have PhD level LSSPs in the state. And so they then, you instead would have license of licensed psychologist, licensed psychological associate, and school psychologist.
Okay.
And
Thank you.
so what I'm seeing here is the rule change that you all submitted is specifically for those that either have their PhD or have received the certification through NCSP. So they've gotten all of those
It would be if
credentials.
you meet the requirements as currently laid out for our LSSP license. We're just changing the name of the license.
Got it. Okay.
And I thought I was proposing a rule, so I apologize for not following the correct rule-making process today.
Quite all right.
Speak to
The
them about
only,
that.
the only thing that I can think of that I think might be an issue is that, like you said, it's just changing the license. So in Texas, it would be a PhD level sort of psychologist.
No, it'd still be those of us with a specialist level. And I do want to differentiate masters because for the LSSP license, you have to have a minimum of 60 graduate hours, which now is before my time, I have a master's degree. But since that time when I graduated, the Texas Higher Ed Coordinating Board created the specialist degree. So it goes master's, specialist, PhD. Most of our programs in the state of Texas for school psychology programs are trained at the specialist level.
I see. Okay, so you wouldn't, I mean, if we changed the name, you would still, the qualifications would be the same.
Correct. We are not lowering the standards. This doesn't create an undue hardship on anybody. We are literally just changing the name of the license.
I see. Thank you.
Out of curiosity, and this is more just, I guess, point of information, would this be something that we would change it in our rules, or change it in our stuff, but then would we also have to engage like TEA or the ledge for this?
I don't think so.
Because they follow
This is-
you, and
this is-
and as you see in the letter I submitted, there's actually parts in the Texas Education Code that actually already say school psychologist.
Right.
Okay.
You say something?
Yeah, I didn't want to wanted to wait till the conversation was done before I spoke. In the rule packet, I don't know if, I apologize, I printed out Ms. Arnold's and Task's letters, but I forgot to put the actual rule text that I had drafted in the printed up packet. It's in the board packet in the electronic version, so I can read what it says. But they had some proposed changes here, but I wanted to talk about just briefly. Some of the issues with this is if you look at the occupations code in 501, I think it's 501-260, it's the LSSP statute. It specifically states that the council will issue a license as a specialist in school psychology, basically with the term LSSP. But what it also says is that this license qualifies for what's required under Education Code, and I think it's like 21003. And if you look at Education Code, the Education Code, it says school psychologist. So the title is in the Education Code, the LSSP title is in the Occupations Code. And so what Daryl and I looked at and what we proposed is there's specific language I could read to you, but I would say that it would need to be changed a little bit differently. It would still need to have the LSSP license, the LSSP title, but if we wanted to do it, it would basically say that you could also use the term school psychologist, but as referenced in the Education Code. But what I would strongly recommend is we could propose it, and then either before proposing it, after proposing it, at any point, also submit a request to the Attorney General's office for an opinion on it, because it's as LSSPs always are, they're a unique, they're a unique license in that you have Education Code, you have Occupations Code, and so I think there is a good argument for why you could potentially call it that, but there's also the Occupations Code that has another name for it. So it's a little bit, that's where the difficulty is, and so I think it would be the safest course is to ask the AG and say, did we overstep our bounds in doing this?
The point is that the statute passed by the legislature refers to it as two different things. And we're essentially here in a position of like, we would like to call it the other one.
So, yeah, and if a tiny bit of background that may be, I haven't done the complete research, but my general understanding is this was back when it was in the Education Code because
Correct.
TEA was originally doing this.
Correct.
And they were using different titles, and then they kept that, but then they created the Occupations Code and moved things over
Correct.
to the Psychology Board. And so then you had these two
After
things
Senate
that,
Bill 1 in 1995.
Yeah.
So when we were certified under TEA, our title was Associate School Psychologist. TEA got out of the credentialing business, and so Senate Bill 1 in 1995 sent us, speech-language pathologists, OTs, and PTs, from TEA, where you got a certificate, to your respective licensing board. And so TEA, he's right, the Texas Education Code remained the same, because that's what we were called, but then the Occupations Code was created in 95, calling the license LSSP.
So-
So it's not just a simple issue that we could just go ahead and fix it today. It will take some time, and that means there's going to be more agencies involved, right?
Well, if I understand Patrick correctly, you could propose the rule and at the same time ask for an AG opinion that we've made this rule, are we okay in making that rule?
Essentially, and asking for an AG opinion, like it's an AG opinion is
Yes.
number one, not binding. Number two, I mean, it gives we're going to be if we're taking action on this contemporaneously with asking for an AG opinion, surely they're going to be aware we're going through rulemaking on this, so they can cry foul and say no if they feel that way. But we're not making it up out of thin air. It's already in the statute. If it was not in the statute somewhere, I think we would be in maybe getting out over our skis a little bit. But it's in the statute already.
Well, and so that was the point I was going to make a few minutes ago. Based on what we were talking about, it sounds like a large portion of the framework is already in place for it. I mean, it's just pulling a few levers.
Yeah, I would say there's, what is there, 4 options. One is do nothing. One is propose the change, and when you propose the change, either ask for the AG opinion, or ask for the AG opinion before it, or go ahead and make the change, and after the change is done, ask for the AG opinion. I would definitely ask for the AG opinion, and it doesn't hurt to go ahead and just, if you want to propose it and also ask for it. The issue will be is I don't know when we'll get an answer from the AG, but at least we've submitted the request to the AG, and
Yeah.
depending on how it comes back, we'll then know. If I can just read you real quickly what I would recommend making the change to, it's subsection D of 465.38, and it would say, the correct title for an individual holding a specialist in school psychology license is licensed specialist in school psychology, striking through the or, and then putting a parenthetical around the LSSP, comma, or the individual may use the title school psychologist or licensed school psychologist as referenced in section 21.003 of the Education Code, period. And then the remainder of it would continue that way.
We're not even changing anything. We're just simply pointing to like you can use the other title.
That's in the Education Code.
Yeah.
Are we soliciting motions?
And if there's, I don't want to short
Yeah,
circuit
yeah.
discussion, but if the floor's open.
I feel like this seems really reasonable, and we go to the public comment, which if this continues to be a contentious issue, I am certain that we will hear about it. But it almost feels like we've passed this as a challenge, I hope. If we are 48 states in the country that have moved past this issue, it feels like Texas should do the same. And maybe I'm just naive in that thinking.
I don't think you're naive. I think you're.
No,
So-
that was the hang up for me, is that we're one of 2 states that doesn't. I mean, clearly it's not, breaking the earth or anything in other areas. So, I don't know.
Floor's
It just
open.
seems very reasonable to me.
I move to adopt the language that
I second
Patrick
that.
has proposed here.
Yeah.
All in favor signify by saying aye.
Aye.
Any opposed? Thank you. Thank you, Mr. Arnold.
Congratulations.
Yeah, we gotta get it through the process first.
Oh, what about the request for Attorney
Do
General?
it, yeah. We could either do
How
that
do we
now or-
do that,
We could either do
Patrick?
that now. or
Ask
later.
for it, do a vote and a motion, and then what we'll do is probably have to send it to the council, and then the council will send it. But I can't imagine that they would not follow that recommendation, I think,
So we have to move to request
An AG
an AG opinion on this,
on the proposed change.
on the proposed change
Second.
to the school psychologist language.
Then second, all in favor signify by saying aye.
Aye.
Any opposed, say no. Thank you.
On behalf of the 4,000 LSSPs, thank you very much.
Maybe school psychologists soon. Okay.